Colombia, the provincial government has announced a $5 million investment to expand virtual mental health services for individuals and frontline healthcare workers during this pandemic. And we have an update from our EBC correspondent, Jeanette Duazo. Hello, Jeanette. Welcome back.
Hi, Alma, and hello to all our viewers. Good morning from here, from British Columbia. Okay, so April 9, British Columbia Premier John Horgan addressed that this pandemic is causing anxiety, stress, depression, or feeling disconnected due to self-isolation to prevent the spread of the virus. To expand the existing mental health programs and services, the province announced a $5 million funding and launched new enhanced virtual services for British Columbians to have increased access to vital mental health during the COVID-19 pandemic. The provincial minister for mental health and addiction said people experiencing anxiety, loneliness, and stress due to lost job, taking care of out-of-school children, or fear of contracting the disease should reach out for help. The province is working in partnership with the Canadian Mental Health Association, BC Division, Boundary Youth Centers, and other community partners to help all British Columbians with mental health needs with focus on adults, youth, and frontline health workers. As these are virtual services, it will also increase access for Indigenous communities and those living in rural and remote parts of the province, as well as those who are currently unable to access in-person supports. The virtual support and care will be offered in multiple languages like English, Punjabi, and Chinese. This $5 million funding is in addition to a coordinated effort across government to reinforce virtual mental health services for children, youth, and students related to the COVID-19 pandemic. The new services include virtual counseling services, online video and phone-based coaching and skills building program, virtual mentoring and goal-oriented supports, peer support, and practical skills courses for coping with stress, problem solving, and boosting mood. The province will also have COVID-19 mental health assessment tool, which will be available on April 20. The province also expanded funding for the BC 211, a province-wide information and referral service to include virtual mental health support for seniors. So the BC 211 was introduced earlier with this COVID-19. It is a service that matches seniors with volunteers to help support seniors in their community with basic needs, including grocery shopping and pharmacy drop-offs and check-ins. So as of April 9, the Provincial Health Officer, Dr. Bonnie Henry, acknowledged the stressful effects of physical distancing and self-isolation, but said that producing positive results. And as of April 9, there are 53,505 tests completed in British Columbia, 1,370 confirmed cases, 858 recovered, and 50 deaths due to COVID-19. The Minister of Health said 30 of the 50 deaths were residents at long-term care facilities. Also on the financial side, the Minister of Finance of British Columbia said that 132,000 jobs were lost as of April 9 due to COVID-19, putting the unemployment rate over 7%. Alma, back to you.
All right. Thank you very much, Jeanette. Always good to hear from you. Thank you for your time.
Thank you for having me. Live from Victoria, British Columbia, Canada. This is Jeanette Duazo. We live in interesting times.
Indeed.